Hello and welcome. If you're a leader at a rural hospital in Massachusetts, you're going to want to pay close attention. We are about to break down what is, no exaggeration, a once-in-a-generation opportunity to not just recapitalize, but totally reimagine how you deliver care. All right, let's get right into it. First things first, let's just put the number on the table. $162 million. That is the initial pot of money that Massachusetts has secured for fiscal year 2026. And no, that's not a typo. This is just the starting line. And that $162 million, it's just the down payment. It's the first part of a 5-year investment that's expected to bring almost $1 billion into the state's rural health system. But I want to be really clear about this. This is not a bailout. It's seed capital. The state is looking to invest in hospitals that are ready to transform. And in the next few minutes, we're going to walk you through exactly how to prove that you're one of them. So you might be asking, why this huge influx of cash, and why right now? Well, it's because this massive investment is a direct answer to a crisis that's been getting deeper and deeper, threatening the very future of rural healthcare in the Commonwealth. Just look at these numbers. They paint a pretty stark picture. In just over a decade, we've lost nearly half of our rural hospitals in Massachusetts, going from 11 down to only 6. This has created massive healthcare deserts, especially out in the western part of the state. And honestly, a lot of the remaining hospitals are struggling to keep the lights on, which means more could close without this kind of intervention. And that crisis has a very real, very human cost. People in rural Massachusetts are dealing with much higher rates of chronic diseases, like hypertension. And look at the opioid mortality rates. These gaps, these disparities, they're not just numbers on a chart. They are the entire reason this grant program exists. The money is meant to go to projects that attack these problems head-on. Okay, so how is the state planning to fix this? Well, to get a piece of this funding, you have to understand their playbook. It's called Vision 2030, and you should think of it as the rulebook. It's the strategic framework that's going to decide who gets a check and who doesn't. Vision 2030 really boils down to 3 big goals. First, expand access to care. They have a specific target. Get 90% of rural residents within a 30-minute drive of essential services. Second, actually improve health outcomes, really go after those chronic diseases. And third, make the whole system stronger through things like getting everyone on integrated data systems. The bottom line for you is simple. Your project has to clearly and directly help the state achieve at least one of these goals. Now for the fun part. How do you match with your hospital needs with what the state wants to fund? Well, they've set up 7 different grant categories, but don't think of it as just a list. Think of these as 7 strategic levers you can pull to get the funding you need to transform. And these categories cover pretty much everything from modernizing your building to developing your workforce, but let's just highlight a couple. That population health lever, that's basically money to help you switch over to value-based care. Innovation in rural care models, that could be your chance to pilot a hospital-at-home program. And the workforce lever, that could fund everything from loan repayment for new hires to building a training pipeline with your local community college. Okay, so we've covered the why and the what. Now let's get to the most important part, the how. This is your step-by-step playbook for putting together an application that really stands out from the pile. And you're going to want to lean in for this one because this is a huge strategic advantage. See, Massachusetts has 2 tiers for what it calls rural. If your hospital serves what they call rural level 2 communities, we're talking the most isolated towns, your application automatically gets priority scoring. Just highlighting that fact in your proposal is one of the easiest ways to get a leg up on the competition. You also need to know exactly where you fit in. This chart breaks it all down. As you can see, if you're a critical access hospital or a small rural hospital, good news, you're eligible for everything, all 7 categories. Now, if you're a larger community hospital that serves a rural area, your eligibility is a bit more conditional, focused on partnerships. And the big academic medical centers, they can only join in as partners. So find your hospital type on this chart and really focus on that recommended strategy. And here's something that should light a fire under you. This timeline is fast. The state is planning to release the official funding notice in March of 2026. Your full application will be due just 2 months later, in May. You'll find out if you won in June for a July 1st start. That window is incredibly tight, which means you can't wait. You need to start preparing like today. This brings us to probably the most crucial point of all, how you tell your story. A weak application just says, hey, we need $200 grand for a new ambulance. A winning application weaves a narrative. It connects that specific need, the new tele-enabled ambulance, directly to one of those Vision 2030 goals, like improving access, and it targets a priority group, like stroke patients in those all-important rural Level 2 towns. It's not just what you ask for, it's how you ask for it. And the reviewers aren't just thinking about the next 5 years. You absolutely have to submit a sustainability plan. You have to answer the question, what happens when this grant money runs out in 2030? For instance, maybe you use the grant to prove that a new service works, and then you can take that data to insurers to get it permanently covered. They need to see a future for your project beyond the grant. If you're wondering where to focus your energy, this scoring chart is basically your cheat sheet. Unsurprisingly, aligning with Vision 2030 is the biggest piece of the pie, at 30%. But look at the rest. Health equity is 20%. Sustainability and community partnership are another 15% each. This tells you loud and clear. A go-it-alone project that doesn't focus on equity or have a long-term plan just isn't going to cut it. So, we've gone over the landscape and the playbook. Let's wrap this up with a super clear, actionable plan that you can start on the second this explainer is over. Okay, here are 4 things you should seriously consider doing this week. 1, put together an internal steering committee. 2, do a deep dive into your data. Figure out where you stand right now on those Vision 2030 goals. 3, get on the phone with the State Office of Rural Health and get on their radar. And 4, start reaching out to your regional partners, your local FQHCs, VNA, EMS. The strongest applications are always collaborative. This Rural Health Transformation Program, it's more than just money, it's a challenge. It's a mandate to innovate. The states put the capital on the table, and they've given you the roadmap. So really, the only question left is the one that you and your team get to answer. What transformation will your hospital lead?